Welcome, ladies and gentlemen. My name is Refferty. It's the second digit of my student ID 003, and we from SCDP2 are going to present our student project, Serotonin Syndrome from Behavior and Changes Disorder. Next slide. This is the list of SCDP2 group members. Next slide.
Hello, my name is Pururaswini Astawa and my last three-digit number is 161. Serotonin syndrome is when serotonin levels in the body increase compared to normal levels. Serotonin syndrome is mainly caused by the increase of serotonin activity in the central nervous system and peripheral nervous system. The symptoms of serotonin syndrome is usually experienced by people with schizophrenia, which occurs due to the interaction of two or more serotonergic drugs, such as antidepressant. An example of an antidepressant most often found to cause serotonin syndrome is the selective serotonin reuptake inhibitors, or SSRI class of drugs. The hormone serotonin is a hormone that plays a role in increasing a person's emotion. It means if the amount of serotonin increases, that will automatically affect the body's performance, such as autonomic nervous instability, abnormalities in the neuromuscular system, and is characterized by change in mental status. And it is a bit challenging to diagnose this syndrome because the symptoms can be similar with other kind of mental disorder. So the goals of this project is to understand more clearly about serotonin syndrome.
My name is Dian and my last digit of my student ID is 070 and I will continue the presentation. So the first one is problem formulation. The problem formulation of the student projects are first, what is serotonin syndrome? Second, what is the epidemiology of serotonin syndrome? Third, what are the risk factors of serotonin syndrome? Fourth, what is the pathophysiology of serotonin syndrome? Fifth, what are the symptoms of serotonin syndrome? Sixth, what are the diagnosis and differential diagnosis of serotonin syndrome? And the last one is how to prevent and treat serotonin syndrome. The next one is objective. So the objectives of the student projects are first to inform the definition and epidemiology of serotonin syndrome. Second, to give an understanding about the risk factors of serotonin syndrome. Third, to explain the pathophysiology of serotonin syndrome. Fourth, to give a comprehension about the symptoms of serotonin syndrome. Fifth, to present the information about diagnosis and differential diagnosis of serotonin syndrome. And the last one is to inform the prevention and treatments of serotonin syndrome. The next one is benefits. This literature presents the definition, epidemiology, risk factors, pathophysiology, symptoms, diagnosis, differential diagnosis, prevention, and treatment of serotonin syndrome, which will give the readers new insights. We hope this literature will enhance the knowledge of society and healthcare association regarding this matter. Moreover, we hope that this literature will contribute to better improvement in the health sector. The next presentation will be continued by my friend. The next one is objective. So the objectives of the student projects are first to inform the definition and epidemiology of serotonin syndrome. Second, to give an understanding about the risk factors of serotonin syndrome. Third, to explain the pathophysiology of serotonin syndrome. Fourth, to give a comprehension about the symptoms of serotonin syndrome. Fifth, to present the information about diagnosis and differential diagnosis of serotonin syndrome. And the last one is to inform the prevention and treatments of serotonin syndrome. The next one is benefits. This literature presents the definition, epidemiology, risk factors, pathophysiology, symptoms, diagnosis, differential diagnosis, prevention, and treatment of serotonin syndrome, which will give the readers new insights. We hope this literature will enhance the knowledge of society and healthcare association regarding this matter. Moreover, we hope that this literature will contribute to better improvement in the health sector. The next presentation will be continued by my friend.
Hi, my name is Niputu Urmila with last three digits of student ID 201, and now I'll explain the definition of serotonin syndrome. But firstly, we have to know what is serotonin. So, serotonin or 5-hydroxytryptamine is a monoamine neurotransmitter. The function is to regulate several processes in central nervous system and peripheral nervous system. Serotonin syndrome is elevated serotonergic activity in the peripheral and central nerve system, which is characterized by the range of clinical symptoms including neuromuscular abnormalities, autonomic hyperactivity, and changes in mental state. The amount of serotonin receptor activation and free serotonin is related to these symptoms. The syndrome can be brought on by the administration of two or more medications that increase serotonin neurotransmission in the synaptic cleft, which cause the symptoms accelerated from mild to severe. Serotonin syndrome could be a potentially fatal condition that needs to be examined. So that's all my explanation about definition of serotonin syndrome. Thank you.
Hello everyone, my name is S.Ked with student ID number 212. Due to the range of its clinical manifestation, serotonin syndrome is an uncommon but potentially underdiagnosed and fatal disease, and its symptoms can indicate a few other medical diseases. At the same time, the extensive use of serotonergic drugs, particularly SSRIs, appears to contribute to an increase in reported serotonin syndrome. 6 patients with serotonin syndrome were diagnosed in one study of 112,045 hospitalized patients who were prescribed at least one serotonergic drug. However, the authors noted that a few cases may have gone unnoticed because they also find 3 additional cases that fully made the criteria of serotonin syndrome and cases with documented partial criteria. The polypharmacy and poor medication metabolism in the severely sick may make serotonin syndrome more prevalent. 24 individuals, 7.8, who were included in an observational study of 309 patients in the ICU satisfied the criteria for serotonin syndrome. According to significant United States database, the toxic exposure surveillance system, there were found 55,000 incidents of SSRI poisoning in 2006. It is estimated that 50% of this poisoning fit the serotonin syndrome criteria. Another prominent U.S. data set estimates an incidence of serotonin syndrome ranging from 0.19% to 0.07%. Thank you.
Hello, my name is Bernard Karel Quaresma Fatti, with the last digit of my student number is 103. Now, I will talk about the risk factor. There are several risk factors that may increase the risk of patients suffering from serotonin syndrome. The first one is use of drugs that affect serotonin. One of the leading causes of serotonin syndrome is the use of drugs that affect serotonin level. The second is the drug combination. Using more than one serotonin-acting drug simultaneously or in proximity can increase the risk of serotonin syndrome. The third one is not following the prescribed regimen. Changing the dose or type of medication you take without medical advice can increase the risk of serotonin syndrome. The fourth one is using certain herbs and D3 supplement. Some of herbs supplements such as ginseng, St. John's wort, Syrian rue, and nutmeg can affect serotonin level. The fifth is basic medical condition. Certain medical conditions such as thyroid disorder, liver disease, or metabolic disorder can affect how the body processes serotonin. The sixth one is genetic. There is some evidence that genetic factors may affect how susceptible a person is to serotonin syndrome. That's all the risk factor that I know. Thank you.
Hello, doctor and friend. My name is Amelia Sasikirana Dewi with last digit 207, and today I will explain about the pathophysiology of serotonin syndrome. The first one is serotonin receptor activation. There is 5-HT1A, 5-HT2A, and 5-HT2C receptors. Next is the increased serotonin release. Serotonin builds up and continues to exit receptors when there is an excessive release or poor absorption. Next is the inhibition of serotonin reuptake. There is SSRI and SNRI. Next is the activation of autoreceptors, which is 5-HT1A. Excessive serotonin can lead to the decentralization of downregulation of these autoreceptors. And the last one is hyperactivity of the sympathetic nervous system that can cause heart rate, blood pressures, and body temperatures. That's all from me. Thank you.
Please let me introduce myself. My name is Julyvia Gifensius with the last 3-digit registration number 088. I will now explain about the symptoms of serotonin syndrome. Serotonin syndrome is diagnosed purely on clinical grounds, and so thorough medical history, as well as physical and neurological exams are required to diagnose it. The severity of clinical symptoms experienced by the patient is assumed to correspond to the level of serotonergic activity. There are 3 characteristics of serotonin syndrome. The first one to be disturbed mental status, including anxiety, agitation, and confusion. The third one is the overactivity of the autonomic nervous system, including diaphoresis, tachycardia, hyperthermia, hypertension, vomiting, and diarrhea. And the last characteristic is neuromuscular activity, including muscle rigidity, hyperkinesis, including myoclonus and tremor, hyperreflexia, and bilateral Babensis kind. That's all from me. Thank you.
Hello, my name is Skylenn Hertanto Tan with the last 2 digits of my student ID is 145, and I would like to continue the presentation. So what is the diagnosis? The diagnosis of serotonin syndrome is usually done clinically while carefully examining the patient's symptoms, medication, and physical condition. Some criteria exist for making the diagnosis, but the most accurate is the Hunter test, as the criteria are made specifically for patients with SSRI overdose, not serotonin syndrome over other agents. Therefore, it may not uncover the disease in patients with minor symptoms. The Hunter test includes the Hunter criteria, where the patient has a history of exposure to a serotonergic drug accompanied by one or more of the factors, which include hypertonia, tremor and hyperreflexia, spontaneous, inducible, or ocular involuntary and rhythmic muscle contractions, with agitation or excessive sweating, sometimes also with temperature over 38 degrees Celsius. That's all from me. The next slide will be explained by my friend. Thank you.
Hi everyone, my name is Ngurah Bagus Bhismaka Ariel Putra, and my last 3-digit numbers are 1 to 4. So now we will discuss about the differential diagnosis of serotonin syndrome. So serotonin syndrome is often misdiagnosed as several other deadly diseases that resembles it due to the fact that the identification process is solely based on clinical criteria without the proper observation and consideration of the medication history. And these are some of the most common differential diagnoses of serotonin syndrome, namely neuroleptic malignant syndrome, anticholinergic toxicity, malignant hyperthermia, sedative hypnotic withdrawal, and etc. So now we will discuss one by one about the most common differential diagnosis of serotonin syndrome. Firstly, we will discuss about neuroleptic malignant syndrome, which the symptoms are neuromuscular activity with extrapyramidal symptoms, for example hypokinesia and lead pipe stiffness, and the onset is within days to weeks after the last exposure to dopamine antagonist, which is much slower onset than serotonin syndrome. And next we will discuss about malignant hyperthermia, which the symptoms are rigor mortis-like muscle rigidity, hyperreflexia, hyperthermia, tachycardia, metabolic acidosis, and rising end-tidal carbon dioxide concentration, which the onset is within minutes of exposure of depolarizing muscle blocker, for example, succinylcholine and volatile anesthetic drugs. And third, we will discuss about anticholinergic toxicity. The symptoms are rime, erythematous skin, hypoactive bowel sounds, hyperthermia, agitation, altered mental state, dry mucous membrane, and mydriasis. And the onset is within 2 hours of the last exposure to the drugs. And last, we will discuss about sedative hypnotic drugs withdrawal, which the symptoms are the disorientation and delirium tremens, with hypertension and tachycardia also appear in more severe cases. And the onset is within 48 to 72 hours of the last substance exposure.
Now, we are going to talk about the prevention of serotonin syndrome. There are no established guidelines for preventing serotonin syndrome, but what we do know from prior knowledge or evidence that it begins with improving education and awareness in patients and healthcare providers. Prevention can be divided into 3 categories. First is before prescribing. Physicians need to ask patients about over-the-counter drug, herbal drug, and illicit drug usage. They also need to remind patients to check with their pharmacist before starting a new drug. Second, while prescribing. Physicians need to use the lowest effective dose to decrease the chances of serotonin syndrome happening. They also need to avoid the usage of two high-dose serotonin drugs at the same time to also decrease the chances of serotonin syndrome happening. Third is after prescribing. Physicians need to follow up with patients a few days after increasing the dose or starting a new dose. They also need to check yearly if the patient still needs to be taking the serotonin drug or stopping the serotonin drug. That's all from me. Next slide.
My name is Ana Agus Suma, and the last three digits of my student ID number is 181. Serotonin syndrome is a condition characterized by symptoms ranging from mild to severe. The treatment depends on the severity of the symptoms. Mild cases can be managed in an urgent care facility with supportive care and benzodiazepines used to stabilize vital signs. Moderate cases may require sedation and benzodiazepines, with cyproheptadine being considered if supportive care and benzodiazepines are insufficient. Severe cases may require sedation, muscle paralysis, and intubation in the ICU. Treatment for severe cases involves discontinuing serotonergic agents, providing supportive care, benzodiazepines for sedation, and cyproheptadine if supportive care and benzodiazepines are ineffective. Severe hypertension and tachycardia can be treated using short-acting agents like esmolol or sodium nitroprusside.
Hello everyone, my name is Uttami and my student number is 038, and today I will show you about the conclusion of this student project. So, serotonin syndrome is a condition when the serotonin level in the body is higher compared to the average level. This is caused by increased serotonin activity in the CNS and PNS. The increased reported case of serotonin syndrome appear to be caused by the extensive use of serotonergic drugs, mainly SSRI. Other antidepressants such as MIOI can also affect the serotonin levels in the body. Taking more than one drug and changing the dose without medical advice also cause serotonin syndrome. Genetic factor can also play a role how a person is exposed to serotonin syndrome. Serotonin syndrome is caused by overstimulation of 5-HT1A, 5-HT2A, and 5-HT2C receptors due to excessive serotonin. The downregulation of this receptor caused by too much serotonin might increase serotonin release. The most typical symptoms of serotonin syndrome include the patient mental status abnormalities ranging from disorientation to hallucination and also delirium. As for now, there are no guidelines to prevent serotonin syndrome. Even if such a case exists, physicians and other healthcare providers need to base their decision on accepted prior research. Identifying and discontinuing serotonergic medicines and administering serotonin antagonists might be the best treatment to treat serotonin syndrome. Because of the limited time and acknowledge in writing this student project, we need further and comprehensive data on the serotonin syndrome and its first steps for the prevention. That's all for me. Thank you.
That is all from our student project presentation. We hope that you've gained all the knowledge and insight about serotonin syndrome. We are sorry if we had said something wrong in our presentation. Thank you, and don't forget to subscribe and like the video.